We can do that. We're nutrition. We've got nerve interference checks, or we call that subluxation checks. And we also have we call stem cell or human biologics, and those are really good for regenerating the body. I will tell you, once one of the things that you really have to remember with health is it's dynamic, but I've got a lot of fibro patients I've taken over the years, and this is something you have to think about for a second. You can have fibromyalgia and back pain. You can have fibromyalgia and shoulder pain. You can have fibromyalgia and sciatica. A lot of times, every ache and pain is kind of blamed on the fibromyalgia. And that's not the case. And so we have to eliminate just like anyone can have those, we have to eliminate thing by each complaint, if you will, and try and get as few as you can. And that's going to be one of our huge goals that we do. So, I'd like to just a real short, if you can give like a 30-second answer of, like who you are, how long you've had it, just kind of where you're from, what kind of city, state, and what's your biggest either health complaint or concern? And because I can tailor what I'm talking about based on what I'm hearing here. So if you want to go, Kathy, you look like you're unmuted there. Why don't you go ahead and a little bit,
Oh,
your biggest health complaint, where you're from?
okay. Well, I was born and raised in Michigan, but I spent 30 some years in Florida and came back about 10, 11 years ago. And right now I'm down in Monroe County.
Okay.
I grew up downriver, but I was diagnosed with the fibromyalgia about 30 years ago, a little over 30 years ago, when they eliminated everything else.
Mm-hmm.
I mean, there's a
Yeah.
lot of other things they look at. So I was lucky that I found a rheumatologist who kind of was pretty thorough. But because I had been in car accidents from a young age, and then as an adult, I also had been seeing chiropractors for most of my adult life. I mean, my mom even took me when I was,
Yeah.
younger.
Okay.
And I was seeing one up until I moved back to Michigan 11 years ago. And then I was taking care of my dad who had dementia. And I had a few years where, I wasn't the priority. I mean, I know I
Right.
should have somehow, but, when you're in
Okay.
that situation, you do what you do. And so I haven't really looked for a chiropractor again. But I do have a lot of body pain and a lot of osteoarthritis, and I know they are separate from the fibro.
Okay.
And I also have had, because of the car accidents, I have my neck fused at 4 levels. And
Oh
so
my gosh.
that,
Wow. Yeah.
yeah, I mean, and that happened while I was going through chiropractic, but everyone knows that you can't adjust the neck, but everything else hurts. So,
Okay.
you know,
Thanks. No, that's so kind of whole body, been through a lot, and in down in Monroe there. Okay.
yeah, yeah.
Mary Lou, what's going on with you?
Well, I grew up in Detroit, Northwest Detroit, but we live in Northville right now. And we lived in Livonia, Westland. Now we're in Northville. But I was diagnosed with fibromyalgia. I don't know how long ago, but I was diagnosed with something before that, a different diagnosis. They finally came up with fibromyalgia, but I have other things. I have Raynaud's, I have rosacea, I've got Sjogren's syndrome. So I have other things, and I have a lot of soreness in my body, and it seemed to all start. I've been rear-ended 3 times since I started driving. When I was like 16 or whatever, and it seemed like it did occur after I got like a double whammy. They said I got rear-ended, and then like the car ahead of me stalled out and the car behind me hit me. So I got like both ways is the way they describe it. And it seemed to start sometime after that, the fibromyalgia. So in general, I mean, I just, whatever, I just saw my rheumatologist, a yearly
Yep.
checkup, and I have the SED rate and the ANA marking, and so I just have a variety of things. So,
Wow. Yeah.
you know, I
Yeah. It's interesting you said that because I just was reading a study and you have 13 times higher increase of fibromyalgia after a neck injury. And again, we already had two people in a row with neck injuries, and now they have their symptoms, kind of bloomed, if you will, after that. So
Mhm.
yeah, so you've got a little bit of everything too, achy and the Raynaud's and okay, yeah, okay. Dorothy, you look like you're ready.
I'm ready. I'm from Detroit. I was diagnosed probably about 30 years ago as well.
Oh, okay.
And I too was in a car accident. I was rear-ended many years ago, and I still have what I think is a pinched nerve in my neck that bothers me every now and then. But I have been seeing chiropractors over the years. I think you said you usually see about 4 or 5 chiropractors, and I'm about at that number. But I do like the one I'm going to currently, and he has helped me a lot. Um, Again, I was in a car accident, but I was diagnosed with fibromyalgia and chronic fatigue. So one of my main issues is the fatigue
Mm,
and lower back pain and neck pain, which flares up now and then.
okay.
Sometimes whole body pain. Sometimes I wake up in the morning and I'm like everything hurts. So, but I've learned to
Okay.
deal with it and manage it better.
Okay. All
Mhm.
right. Well, CJ, you got a big smile. Go ahead, let us know what's going on there.
Well, of course, you know who I am, doctor, but I'll
Wow. Yeah.
yeah.
Okay.
Well, I'm Cindy Jovanovski, and I'm the president of the Fibro Group
Yeah.
since 2020. So it's been 4 years now since I took over the group.
Yeah.
So that's really just been a really
Yeah.
great achievement for myself. And plus, I love everybody in the group and all the speakers we have over the years, past and present. I've had fibromyalgia since 2011 or 2012, so it's
Okay.
been like 13 years now. I was diagnosed with other things too, but the main thing I was
Yeah.
trying to research or find out was my pain. Plus I had migraines and fatigue and pain and stomach digestion, all these other issues that I was having. And doctors were just saying, oh, it's all in your head. You're making up all your symptoms. You're drug seeking, blah, blah, blah. You need to see a psychiatrist. Well, that was just too much for me, but I needed to find answers, right? So
Right.
I finally found a doctor that, well, I think he was a family intern medicine doctor, and plus he specialized in drug addiction treatment. They recommended him to see me because that's why they thought I was drug seeking, which I was not. Obviously, they did all the blood tests and everything was negative. So, and the
Right.
doctor asked me all these questions. Where are all my pain? Where is all my pain coming from? Sorry, my speech is acting up.
Yeah.
I'm embarrassed now. So,
That's
um,
okay. I
yeah.
didn't want to put you on the spot, but I didn't want to leave you out.
No,
Yeah,
sometimes
because
I get a little nervous or something, but
yeah.
I'm used to speaking to groups like this. So basically it was like assessing me for all the pain and
Right.
everything, my migraines, my fatigue, stomach issues. And then he said, I don't think you're drug seeking. I think you have something called fibromyalgia.
Okay.
And I was like confused. I'm like, I never heard of such a thing. But I know that I'm glad there
Right.
was such a name because like so doctors can't keep saying it's all in my head. So I'm glad I finally got an answer through all those
Right.
doctors. And I've been seeing all these doctors on a regular basis, including a chiropractor, you guys,
Well,
a
yeah.
neurologist, family doctor. It's just a whole slew of doctors, but um managing
Oh
my
yeah, yeah. You've been
yeah.
doing great. I mean, you wouldn't if you would see her before she came in,
Right.
bent over, gray,
Yeah, you
everything's
gotta
different
tell them,
about you. Your
doctor. Yes.
mood. Oh, it was bad. It was terrible. It was terrible.
Yeah, so the fall
Yeah.
really
So
made things worse, and I think that I
yeah,
aggravated my osteoarthritis as well. So I think I
yeah.
made that worse. So
Okay, that's real good. Thanks, Natalie. You have a thought there on what do you want help with the most, and a little bit about what's going on.
Well, I am in very good health. I have no pain. I'm here to learn how to help people who do have pain.
Oh, fantastic. Okay, great. And there's
Yeah.
only one person left.
Well, where do I start? 30 years ago, I started having the pain from, diagnosed with fibromyalgia, but I have everything wrong with me. You know, if you could name a system in my body, something's wrong with it, from head to toe. Like, got macular degeneration, glaucoma, digestive issues, osteoarthritis, moderate to severe in my whole spine. I get like sciatic. I have pain going from my neck down my arms. It's like I don't take anything for the pain, and that's I just try to keep active, and occasionally I'll take a ibuprofen or naproxen or something. But I also have fatty liver, so I can't take Tylenol. So it's like, okay, so what do? I do see a chiropractor, and I think she helps me. I've gone to a chiropractor for my whole pregnancy and all my youth. 30 years, I went to the same chiropractor, and he had to retire. Now I see somebody else, but it's kind of like, okay, what do you do? Where do you turn? Okay, so you got this pain every morning, all day long. So I want to not have it. And I look for natural things to take instead of, like I love going in the pool and having warm exercise, that kind of thing. So any suggestions?
I have a lot. I have a lot. So yeah, for sure. For sure.
Thank you.
All right. And I think, there we go. Plymouth Gal. You're still muted.
There you go.
There you go.
Bob and I still have issues from time to time. He gets arthritis in his back. I went to a gentleman called Hobbs because he's upper cervical specialty, and I had a neck that, I don't know, I think the seat in the car was kind of turned backwards. We had air conditioning on. It's a 10-hour drive from UP, and I could not turn my neck for quite a few days. So I went to him thinking that maybe it would help. Sometimes I feel that my heart was racing in the middle of the night, and I had real terrible acid reflux. So I was put into some traction, and I think I had some subluxation, and not that it was an injury or anything, but I just think arthritis was there. And when I was younger, probably 18, going to college, I got T-boned in a car. He was considering maybe if it was like a long-term kind of a lot of trauma, like a whiplash. I did have a chin injury when I did have this accident, and I've been rear-ended a few times driving. But I have everything that everybody in the group, the rosacea, the Raynaud's, the restless leg. I'm on Zepbound now to lose weight, and it's creating me like an itchiness, like having black fly bites. I'm not doing that. I'm losing some weight, but and the thyroid is double what my husband is. They keep on saying thyroid conditions, hypothyroidism is the same as having fibromyalgia. This is the endocrinologist. I don't believe that. I know I have osteoarthritis. I got that hip replaced. My knee needs to be probably replaced as well, but I don't want to attempt the surgery, so I'm trying to lose the weight. My arthritis in my feet is where bones are fusing in my, from the osteoarthritis. So you wear the orthotics, and then you feel like you have to change shoes throughout the day because they're very uncomfortable. I would like to feel better. I don't take pain medicine. When I did take pain medicine, Cymbalta or Lyrica, and I mentioned something about severe dry eye, my doctor wrote it down as constipation, which I don't understand why he wasn't honest with his documenting. So that's where I'm at. I'm still going to the same doctor. I'm just, I'm on a cholesterol pill. So, but it was in my early 30s that I think about Cindy. I started out with cysts when I was 18, and with this Zepbound, it's triggered more of a fibroid in my body and cysts on my ovaries. I'm kind of concerned that maybe this is an inflammatory process happening in my body, because I was pinched up like I thought I had appendicitis over a month ago, but they couldn't rule one way or another. They say, don't do crunches, don't do this and that. I'm reading all the little YouTube things, but do I really have somebody going the distance? I went to an OBGYN, even though I'm old. They didn't seem to care the concern. There's another year I can follow up on this. So it's like, I don't know. An endocrinologist hasn't gotten back to me. It's been, over a week, and whether things should be changed with Zepbound. And, you know, I don't know. I try to exercise when I get a chance. I get on an exercise bike. I lift some weights here and there. All the things are still there with me, and it's more to deal with. The sleep apnea is there.
Right.
I'm get my neck checked out because they thought I had a lump in my neck, and I think it's just because my CPAP is sliding on my hair all the time. If I could staple it to my head, I'd be great, but you can't do that, right? So I think about the movie Scrooge, and that's what they were stapling the antlers on heads, right? So my husband's dealt with me. I've even dealt with a sleep apnea doctor that said, oh, get men's mustache cream to stick it on the appliance so it sticks to your skin. Or somebody will tell you to put Vaseline on your face when it breaks down the plastic that you put on your face. My husband has issues with hemoglobin being high, platelets being high because of CPAP possibly. He's had atrial fib. There's things that, the
Right.
fish oil can cause atrial. I don't know if it's true, but what do you see on that?
Yeah. So there are some common themes going on right now. When I talk about the things that we're going to check for in our office, toxicity and deficiency. If you're toxic and what makes one person toxic isn't toxic to another. I could say, let's all have a glass of wine, and someone might end up with a massive migraine, and someone goes, that was delicious. I could say, hey, let's go have some MSG, and then again, someone's like, oh my gosh, my stomach is, meaning something, some preserved food, and someone goes, oh, I can't. That really tears up my guts drinking a glass of milk. Other person says, no, a glass of milk is great. I have it all the time. So we really have to when you do your health journey, one of the things we want to do is start to figure out what things are inflammatory to you. Our diet, the American diet, is pretty inflammatory. It's a lot of refined foods. I know you guys probably are trying to do that. It's a lot of extra chemicals and additives in it. And if our liver gets backed up, gets too toxic, you don't process the toxic chemicals as well, and that actually bleeds out somewhere else. Maybe it's a skin issue, maybe it's a stomach issue, maybe it's fatigue, but maybe it's chronic inflammation. So one of the things that we want to do when you come into our offices, or when we talk to anyone originally, is like, let's figure out how to get inflammation out of your diet. Because you might think you're doing really good, but you might have food sensitivities and allergies that are keeping you chronically inflamed. Some people also, we talk about deficiencies, say, well, I take my B12, I take my vitamin C, I take my calcium, but guess what? They're not absorbing it properly. Their stomach is not that good. Their digestive system is not that strong, or the quality of the substance that they're taking is not good enough. If you even take, for example, something as simple as calcium, everyone on this phone call should be taking calcium. But if you just simply walk into the local CVS and you take calcium, you're going to end up probably getting calcium carbonate. Calcium carbonate is actually the chemical for chalk or marble. And eating chalk and marble, you'll take it every day, but you won't get anything from it. So one of the things we offer in our office is really high absorbability, high quality vitamins. But some people, again, their stomach isn't good enough. We actually then can go intramuscular injections like B12s or vitamin D or different things. So if you don't have enough healthy material, healthy vitamins and minerals in your body, your inflammation is going to go high. And if I say, how do you feel when you're inflamed? Achy, fatigue, sore, brain fog, sluggish. And what are all the symptoms of chronic fatigue? Achy, fatigue, brain fog, sluggish. So we have to go, okay, great. Let's take a look let's break down your diet. Let's make sure you got the right nutrition, toxicities, and deficiencies. Well, you have to start reading labels and start realizing maybe you feel worse after you have certain meals or foods the next day. A lot of times people say, like I heard someone say, oh, they just wake up and they feel like they're hit by a train. Well, something changed. So was it a change in their diet? Was it a change in their pinched nerves? Because I'll tell you, everyone, the common theme in here, there was an accident or a trauma. And accidents and trauma, they can linger on or cause things that you need to manage. Does it make sense? Like, some people are diabetic and they can't go eat a piece of cake. That would be just a bad idea. Other people can eat cake, seems like every day, and they don't gain weight, nothing happens, right? So what we have to go is, some people have to manage their spine because they've got old injuries and things tend to slide, and they've got arthritis. You can't reverse some of those things in the spine but you can manage it by keeping taking care of it, whether that's an exercise program, whether it's a stretching program. But before you can even stretch and exercise, you got to make sure it's aligned properly. And a lot of times people have had some care in the past and it's helpful, but they need the length of care and the quantity of care and then to check it to see if it's as good as it can get. Does that make sense?
Yeah, well, my husband's on acid reflux pills and you can't absorb calcium. So they tell you to go instead of every other day. He tried to go 3 days, so he's coughing like crazy. So now we're back to every other day. I don't know. It's not happening where he's receiving the calcium. The doctors don't want me to have calcium, too much calcium.
Yeah.
There's certain things because of thyroid. You can't do the B vitamins because you're thyroid. That one person, it's like they're so anti. You go to a skin doctor, they say, oh, you can take the stuff biotin. Then you go to the next doctor, they don't agree to anything. So it's like you just
Right. And it gets confusing. And at some point, you throw your hands up and go, whatever, but you have to step back to the basics. Does a person need calcium? Yes or no?
yes.
Yes.
Yeah.
Right. Does a person need vitamin D? Yes or no? Yes. Right. So one of the things that we need to do is in our offices, we actually might have you bring in blood work and we say, okay, let's look at it. Because we really got to get the solution to like what's going on with you. You may not need vitamin D if your levels are in your blood work are fine. You may need, but if they're not, if you have low vitamin D, that's going to cause chronic fatigue. That's going to cause more cancer issues. It's going to cause anxiety and stress. You have to have omegas. So you can have to start figuring out a checklist, like you said, when you talk to a doctor, and does this make sense, like for a living person in here? I've heard so many doctors say so many strange things that it's boggling to me. So again, we have to look at deficiencies. We have to look at joint damage and strengthening. We talk about hormones. A lot of these things. I'll give you an easy thought here. Okay, so thyroid issues are run rampant right now. Anyone know anyone with a thyroid issue? High, low? Yeah. Okay. So do you know that they put fluoride in our drinking water? Yes or no?
Yes.
Yes.
Yes. And now I don't know if you know this, but fluoride and iodine are both metals, they're both chemicals. But if you have a fluoride molecule floating along in your blood, and you have an iodine floating along in your blood, the fluoride will attach to your thyroid stronger and faster than the iodine. So now you're blocking receptors and the body can't process the fluoride. So fluoride actually causes thyroid issues. And I don't know, you guys probably don't think about it, but who put something so toxic in their mouth this morning they had to spit it out?
Your toothpaste.
Brush your
Yeah.
teeth, you gotta spit it out. That's more fluoride, right? So
Yeah.
when we want to make sure that we're working through all these little parts because it's not going to be a one-stop solution. It's not going to be a one and done, but it's going to be, well, we get this a little bit better and that a little bit better, and we get rid of this toxin, we add this nutrition, and then we start to see your scales tilt over time. So that's one of the things that we have the ability to. We also have, which we call, and the ability to give your body something called mesenchymal stem cells. Now, mesenchymal stem cells, if you remember, your body has a bunch of little healing cells in them that haven't become anything. These stem cells, you have more when you're born. You have about and less as you age. That's why kids repair faster. You ever see kids, they fall down, they get up, they barely hurt, they don't stop, they do it, right? They fall down 100 times a day and they keep going. If we fell down once a day, we might be done for a while. And that's because our body doesn't repair properly. So what we do is we've got, in our office, we got a nurse practitioner, and what they can actually do is these cells can go to damaged areas and start to create healing. Now, the cells themselves are actually harvested from a donation. So when mom has a baby nowadays, they can save the placenta, they can save the umbilical cord and freeze it, or they can donate it. So these are live cesarean section bursts, and instead of discarding it, they can donate it. In there are a bunch of brand new cells ready to do some healing and do some good things. So these stem cells can be harvested, and then they actually can be they actually can be transferred over. Now, there's no rejection because they're too young to say, hey, you know, I'm Dorothy cells and I'm Mary Lou cells. They're too young. They haven't differentiated. They're not a muscle cell. They're not a ligament cell. They're not a tendon cell. They're not a bone cell. But they're the preemptive. They're the cell that changes into those things. So those can actually go into, you can put them in as an IV therapy, and they'll go hit parts of the body that are struggling. If you don't have the healing power yourself, you're actually adding in cells that have that healing power built in. So that actually is a game changer. It's something that is been going around for about 20 years, but in Michigan, it's just become allowed that chiropractors can do it. It's done in other offices, but chiropractors can do it in conjunction with a medical doctor, in conjunction with a nurse practitioner. I personally I'm not going to give anyone any injections. I move spines, but I have a team that can go, hey, how can we do a game-changing thing, something that's not been done before, but the research is out there at how well it is working. So we've got between IV muscular injections, between stem cell, between checking for nerves, we check your balance, and that's one of the things I didn't spend much time on. You really have to have your balance checked regularly because falls are the biggest danger for seniors. Let me say it again, falls. And if your back is off, your hips are off, your balance is off, your likelihood of falls keeps going up. So we actually check your balance with make you stand on 2 scales at the same time and see, are you leaning? I mean, coming in for that alone is a game changer to know how you are, how you're standing. So we also want to make sure that we're actually able to monitor our results, you know, and Cindy will tell you we are just checking results every so many visits. We're comparing how were you from your last time, how are you to now. We actually in our office will do x-rays, how much degeneration and arthritis is there. So you need to keep a track of your x-rays, and that's my recommendation of your spine. How is it doing? Is it wearing? Is it keeping up? Are you getting a head forward posture more? You starting to lean forward, because that leads to more spinal damage. Are you with me on those things so far? I know I'm throwing a lot at you. Yeah.
I have a question. There was something I thought was interesting. My husband did too. I don't know if it's gimmicky or what, but when you go to a chiropractor, if you have caffeine, there's some kind of a thing that you can see whether there's alignment or not, some little triggering device or some kind of thing. Are you aware of anything like that?
Monitor your caffeine intake in our office.
Yeah.
I know there are different measures they do, and if you have too much caffeine, anyone have too much caffeine, they get a little shaky, right? So a little bit too much caffeine can actually. Hey, good to see you.
Triggering thing.
It was some kind of meter. It had little 2 probes on it, and you ran it down the back of her neck.
Oh, for temperature.
Yeah. Okay.
Yeah, to detect for inflammation, right? If you've got pinched nerves, it can actually be a little bit more hot or more inflamed on one side. And we see if a nerve is pinched, it'll be kind of, the needle will change to the hot spot or cold spot. So yeah, I'm familiar.
It was at a dial and it was centered, and it would go
right or left, and yeah. Those are interesting. I've not used them in a long time, but because you have to be without your shirt off, and you have to be a certain amount of time. There's a lot of different reasons for it, but we actually get great results without that, and that's the bottom line is results. The bottom line is results. How you get them doesn't matter. That you get them matters. So I just wanted to kind of encourage you to know, just like you are right now, start attacking individual symptoms one at a time is your best way to start getting healthier. You can't say, well, I've got chronic fatigue and Raynaud's, and you're not going to fix them all at the same time. But I'll tell you, we've been able to fix every symptom that you've listed. We've had people have remission from. They've gone into remission and they just don't have it anymore. So not saying they won't ever have it again, but who cares? They don't have it now, and they haven't had it in a long time. The goal is to get better now and stay better as you go forward. Does that make sense? Okay. Is there anything else? I got about 3 or 4 more minutes. Any last minute questions? And if not, I just want to give a little suggestion before I wrap up
In
here.
regard to the stem cells, is that something that insurance covers, or is that something that's out of pocket?
Yeah, the stem cells are, well, we do what we call also something else called platelet-rich plasma, and that's taking your own blood, spinning it down in a centrifuge, and injecting it into a site that, like an arthritic site or a joint injury site or different places. There's a bill out there to have Medicare pay for that, and if Medicare pays for that, that'll be a game changer. But I don't know if that's going to happen. But the stem cells themselves are not, and unfortunately, like I was telling someone with bone on bone knee, I'm like, they'll replace your knee, a $50,000 surgery plus rehab plus everything else, but they won't pay a couple, this 10-20% of that just to get the stem cells and let your knee regenerate. It's actually
I know.
regenerates
That's so
the body. The stem cells help regenerate. So even though it's not covered, it's a game. It's so powerful. It's worth it. We definitely.
Mm.
If you're a candidate, it's definitely can change a lot. Yeah.
I've got a friend, if you can hear me, that fractured her spine. She was helping somebody that had Alzheimer's get up, and she heard a pop in her back. She fractured her spine, and it had been like 4 weeks, and it wasn't healing. I took her to a specialist. The specialist said, inject it with paste. She thinks that somebody told her in the same line you are that not to get it done because there's too many side effects, not to get the paste put in her back. Have you come across anybody with, I'm talking about somebody that has osteoporosis and that somebody's
Sure.
in her 70s.
Right. So the answer to that is, I've never told someone not to get it in with paste cement to they can actually reinflate a crushed vertebra that's done, and it should stay right in the place. And I'm not going to make a call on why they thought that was for that particular patient the right thing, but I generally have not come across telling someone not to do something.
Yeah,
like that.
I was kind of worried about it. I was all set to take her, and she's like, "Oh, give it 8 weeks, and it'll probably heal all the way." But then they say once they put the paste in, it looks like it's always been damaged, but you won't have the pain, and she still has the pain. And I'm like, that's her, not me. So anyhow,
Right.
Thanks.
Yeah.
Appreciate
Yeah.
it.
Hey, Janet.
Yeah.
Janet,
Yeah.
in my experience in the past, having worked in the radiology field, the paste or the glue or whatever they use is injected into the cracks in the vertebrae itself, the bone itself. They don't put it in the space between the vertebrae. So
Right.
what they're trying to do is stabilize the fracture so that it doesn't get any bigger. Obviously, if it's if it's all the way through, that's different. But if it's not all the way through,
Halfway.
that's one of the ways that they treat it.
Yeah,
Yeah.
that's what. So thanks, guys.
Yeah, and they also may have twisted their spine when they fell. They may have pinched nerves in there, from not just bone damage, but
Right.
a lot of times things do. It
Well-
says 5 minutes, so I want to wrap up
Yeah.
here.
All right,
I definitely, Cindy can take any additional questions that you have. I want to thank you for listening in, but I do know right now we're doing something amazing. I don't know if you've ever heard of Operation Christmas Child. What we're doing is what we're doing is we're allowing people, if you want to donate $50 to which is a Franklin Grant Ministry, Operation Christmas Child, OCC, they'll send 5 shoe boxes around the world of toys for kids.
Ooh, yeah.
And
yeah.
what I would be willing to do for anyone who wants to is give you guys a good 20-minute solid consultation of just questions, do about 10 minutes of testing. If you need x-rays, take x-rays. If you need, just to kind of, do an exam, a history, do a physical on you, just to see is something being missed. You've gone to chiropractors, maybe they've done everything that they should, maybe a second set of eyes would be helpful. So we do an exam, history, consultation, and a physical, and just to see if maybe you need stem cell. Maybe I would suggest that would be your next step. Maybe you need to do some nutritional stuff. Maybe you need a detox. Maybe you're on the right track. It just needs more time. I don't know. I don't know. And that would be what that would help me understand is how can I help you make 2025 your best? So that offer is going to be going and by the 23rd, unfortunately, it's wrapped up because obviously they need the money for, by Christmas there.
Yeah.
But yeah, so if anyone is interested, Cindy has all the information. You can schedule an appointment the next couple of weeks to sit down and talk about that. You can write a check to Operation Christmas Child or bring the money in and we're going to write a big check for anyone who didn't directly donate to the charity. But it's a win-win. You're going to get toys to kids and we're going to see if there's something more we can do. And if you don't want to do it, you can pass it to a friend because you obviously are looking for better health and you probably know the people that need better health. Does that make sense?
Yep. Great.
Okay. All right. So thank you so much for your time. Any questions
Thank
about
you.
that before we get cut off?
Oh, thank you so much again for
Thank
speaking,
you.
Dr. Michael. Is it okay to share the recording? I forgot to ask you that at the beginning.
Sure.
Okay. I always ask my speakers just to get their permission. So
Yeah.
Yeah.
Okay.
Our church
Thank you.
did
you.
1,800 shoe boxes for the Operation Christmas Child.
Oh, great job. Great job. Okay, everyone. Well, you have a Merry Christmas. Hopefully, it was nice to be able to talk to you. It'd be nice to see you get better. And I do believe I've had so much success evaluating you that we could do something for you, if not amazing, and a lot of things for you. And Cindy would attest to that. She's been seeing other people get amazing results as well, not just her. Okay, you guys have a great day.
Thank you.
Thank
you.
Thank you. Merry Christmas.
Merry Christmas.
Christmas. Just a minute, baby.